Hello everyone. Today's video is about implant abutments and not any abutments. It is specifically about hexed and non-hexed abutments. This abutment has surfaces matching the inner hex of the implants. And in non-hex abutments, we don't have such surfaces, flat surfaces that engage the implants. Those are called non-hex abutment, also known as non-engaging abutments. Usually the abutments, regular abutments which are available, those are usually hex or engaging abutments. Now, why do we need to have non-engaging or non-hexed abutments? Non-hexed abutments are generally used in cases where there are more than one implant placed and the restoration is going to be a screw retain restoration where implants are non-parallel to each other. Now, non-hexed abutments have certain disadvantages. The disadvantage is that since the non-hex abutments doesn't have any retentive surfaces, we cannot use such abutments where we are planning to give the patient a cemented restoration, like in case of a 3-unit bridge, implant supported bridge. Another disadvantage of non-hex abutment is that in non-hex abutment, since there is actually no retentive surfaces like a hex abutments, there is a certain microgap present between the implant and the abutment surface. In case of situations, if there is more stress is generated on the prosthesis, in case of non-hexed abutments, this stress is applied along this surface, this micrograph formed, and through this gap, the oral environment, through the oral environment, saliva and bacteria can penetrate. This is a disadvantage, though various other studies have also come up with evidence that this microgap is that minimum that it doesn't affect on the implant health. Now, another problem with the non-hex abutment has been found that if the prosthesis and along with the abutment is placed which is not passive, it can cause more stress on the screws in case of non-hex abutments, that thus causing not frequent, but this causing incidents where there can be screw loosenings. So from this present discussion, we can very well conclude that in case of a single implant, we should use a hexed abutment only, because if we use a non-hexed abutment, it will not provide the retention that is a single crown needs. And in case of more than one implant, so like 2 implant retained bridge, we can either use a hexed or a non-hexed abutment. If we are planning the prosthesis to be cement retained, then we definitely have to give a hexed abutment. Otherwise, we won't get sufficient retention in such cases. Another reason for this is usually in case of hexed abutments, the abutments are fixed to the implants first, then the prosthesis is attached to it. Whereas in case of non-hexed abutment, the abutment and the prosthesis is made outside, which is then screwed with the implants. And in cases of multiple implants, we need to use non-hexed or non-engaging abutments. Hope this video will help to clear the doubt about hexed and non-hexed abutments and when and where we should use them.